Research conducted by the Walter Sisulu University and the Human Sciences Research Council has found that lockdown restrictions and regulations on how funerals must be conducted have caused considerable disruption, anxiety, and misunderstandings around funeral practices in some parts of the Eastern Cape. Under the current provisions, 50 people are allowed to attend a funeral. To discuss this further, we are now joined by Dr. Vuyokazi Nelly Sharpley, the Head of Social Sciences in the Faculty of Humanities, Social Sciences and Law at the Walter Sisulu University. She joins me now live via Skype. Good afternoon to you, Doc. Thank you so much for joining us here on the SABC News channel.
Good afternoon, Pelisa and the viewers at home. Thank you.
Thank you so much indeed. So what has been the impact of this lockdown on how we conduct funeral, traditionally so and culturally so?
Traditionally, normally funerals in an African community are actually a community event. It involves an event that involves not only the bereaved family, but also involves the society and the neighbors and relatives and external family members to come and actually pay the last respects and support the family. The reason that has been given to that was the fact that people needed to have a process of closure as well as to be able to bury their loved one in a dignified way. Now, with the lockdown regulations, this has not been happening, where funerals are cut short in terms of the time frame that they have to be conducted. Within a period of an hour or less, within a period of 2 hours or less, the funeral has to be over. The number of people that have to come, with the police being there to make sure that they don't exceed the number of the people, which are 50. This has not allowed the family to have the closure or to feel they have done a proper burial for their loved ones. The viewing of the body also being a challenge because they couldn't even guarantee that they are burying the right person.
Mm-hmm. And as we know that as Africans, funerals are, that sacred and personal occasion for us. In your understanding and your assessment, were the lockdown regulations enforced with the level of sensitivity it deserves?
The research that we have done with the Human Science Research Council, together with our university, Walter Sisulu University, with the participants from the 10 communities in our district, OR Tambo, we realized that most of the people were expressing the fact that the rules were not really communicated to them, even through the structures of their traditional leaders or counselors, to be able to understand the change, and even for them to be able to negotiate some changes that have to do with their sacred rites and rituals in culture. And the fact that they had to be policed and to have to police the situation of the adherence to the rules was actually another problem. The people actually expressed what you would call a cry, and as well as a feeling of hurt and a feeling of being robbed a time to be able to say goodbye in a proper way to their loved ones as they pass on to another life.
Mm-hmm. And what sense did you get from the people that you spoke to when conducting this research in terms of grieving? Because we know that in our culture, most of the time, we do not just grieve on the actual day of the burial, but it is a process leading to the actual day of the burial, meaning that you have people coming to the house, on a daily basis, bringing prayer and the likes before the actual day of the burial. So what sense did you get? Did you get a sense that the regulations have sort of affected the way we grieve or the grieving processes, as we know that funerals, especially in African cultures, are events that can go on for more than a day?
From the participants, it was clear that the lockdown regulations, particularly to funerals, have not really been provided with the sensitivity that is expected by the people. The rules were more enforced without having to enroll the understanding and embracement of the people into those. Where, for example, you would have umlindo before the funeral, which is the night vigil that people would have, where they will actually say their praises and their words to the one who has passed on, while also comforting the family through prayer and also through words. That has not happened. The families were not allowed to do that because the gathering was so limited to a point that only at the time of the burial that you would see people gathering together. And even that gathering being limited to a point that at the time where you still have family members who are willing to come in, you have to close the gates. So that was something that kept on coming to them. It was painful for them to go through the experience of closing the gate and not allow other people who are part of the grieving family to be able to come in because the number is already full.
Mm-hmm. And also talk to us about, as we know that your study is based largely in rural Eastern Cape. Take us through some of the concerns concerns when it comes to the handling of the body of someone who actually might have died from COVID-19 related deaths. What did you get there? As you say that your observations were that there was some lack of understanding and education on the lockdown regulations when it comes to funerals.
What we discovered is that people, firstly, they lacked the knowledge of what is COVID-19 in the rural setting, because the study was in fact focused mostly on the rural areas of the Eastern Cape, predominantly the OR Tambo district, which is made of the former Transkei. Now, people needed to have an awareness of what is COVID-19 and what is it that they can do to protect themselves from the virus and the others around them. And the lack of that understanding in terms of awareness, now, it didn't prepare the people on the things that are necessary to be changed, even when it comes to the funeral rituals and the culture that surrounds funerals. The communal support that is supposed to be there, it didn't prepare them in that way. So what happened was when what they were expressing was colliding with the rules, true law enforcement, like police being there, where they had to come to an understanding of realizing what is it that is expected and what is this COVID-19 and so forth. So those were the challenges of the fact that when people were not empowered with the knowledge, then they didn't know how to adhere. But to an extent where they managed to get that information, you could see collaboration with the people. Where they would even have registers to count the number of people inside. But then at the same time, it was a strange process for them not to be able to view the body, to be able to wash the body, to be able to dress the body as they usually do when somebody has passed on, because there is no distance between the dead and the living in the process of mourning in an African culture. So all those things did not happen. And that's why we are saying right now, the people were saying they don't have the closure.
So what then happens going forward? Do you have any recommendations from the study?
The study, as I said, it was in collaboration with the Eastern Cape government as well as the HSRC. We are busy right now with the final report, a report that would have clear recommendations to be actually tabled in front of the Eastern Cape government, so that the government from there can be able to look at the recommendations that are directed to the policy as well as to the regulations and to the livelihood of the people in the rural settings of the Eastern Cape. So soon you will hear more about the recommendations, but in line with how the rules can be sensitive in embracing people as well as their culture.
All right, quite an interesting one. We really are looking forward to hearing about the recommendations. We thank you so much for coming through.